Hi, Dr. Tim here. So a lot of people ask me, what is it that really brings me to help a lot of kids, to help a lot of people who's overweight, and why am I so passionate about helping people who are overweight? I believe that, it goes back to the day I remember as a child when my grandmother, she's been, as long as I could remember, overweight all her life. And the changing factor for her life that really took a downturn was the fact that she was diagnosed with diabetes. I remember as a child, in maybe about 8 to 10 years old, she came back from the doctors and the doctor told her, you know what, you have diabetes. As she was trying to explain to my grandfather and my father what it was, we didn't have the education to know what diabetes was. We just knew that it was something that, you know what, this is not something that we want to stay away from it, but my grandmother had it. And it was something that was troubling to our whole family as to why she even had it in the first place. And we never really realized why it was. But she followed a lot of her doctor's advice. She took the medications. They told her to stay off meat, right? And really just eat everything in light. So she ate a lot of small meals throughout the day. So I could remember that as a child, she would have my sister and my cousins eat very small meals in the morning. She'll pack us a snack, mid-morning, and then we'll have lunch. And when we get home from school, it'll be an afternoon snack. Then we have dinner, right? But then what happens after dinner is we'll go out and maybe have an ice cream at McDonald's or something. I, growing up, was known as the chubby kid among my friends. And part of it was, I think, the upbringing of my grandmother. As far as I can remember, she has been overweight. I've never met my grandmother in the pictures that she took when she was in her 20s and 30s, when she was actually, thin or more of a lower BMI weight. So she's always been overweight or obese. And as she got older, she was diagnosed with diabetes and she became even more overweight. Well, eventually she got to the point where I remember she could not walk and she had to be in a wheelchair. And really that was when her life just took another downturn. Is first she was diagnosed with diabetes, okay? That affected her whole family, but then she couldn't walk anymore and she had to be wheelchaired everywhere. Then she was dealing with pain. I remember as a child coming to the US, every time I will go back to visit her, multiple times, and she's came and visit us, but every time I saw her, her health declined and it got worse and worse and worse. And I look back at it as, that's something that is in my genes. Well, I better do something about it to really change that history, right? My father, when we came to the States, he, within 2 to 3 years, developed a gut in his stomach, and he's never had a gut before. You look back at the pictures of my father, for as long as I can see, he was very fit. But the moment he came to the US and adopted the SAD diet, right, the Standard American Diet, SAD, he started to gain weight and activity levels, but really it's the food that he was eating. So my passion comes from, I look at my whole line of family where where my grandmother had diabetes, neuropathy, and passed away from that. My father, eventually 2 years coming to the States, developed a gut, and eventually, I'll tell you his history, is eventually he developed non-Hodgkin's lymphoma. And part of it is you have to know obesity and people who are overweight has higher chances of developing heart disease, respiratory disease, cancer, and other autoimmune diseases. It's just studies have shown that. And part of what I believe is, had him been contracted or he developed non-Hodgkin's lymphoma is the fact that part of it was because he was pretty overweight. And he's always had a gut. The last 10, 15 years of his life, he had a gut. And that is something that I look at, for my family lineage and why I want to make sure that. So not only am I passionate about helping other people lose weight, part of that is helping myself lose weight and to prove to myself that I don't have to follow my family's lineage so that I can make a change. See, it takes one generation, whether it's a child or an adult, to make that change. See, studies show that when you are a child and you are overweight or obese, your chance of being overweight and obese is 79%. So you look around out there and just about 2/3 of the kids nowadays are either overweight or obese. The chances of those kids becoming overweight and obese when they're adults is 79%. Whereas if you took a look at a child who's normal weight, the chance of that child being overweight and obese is only 5%. So that's a huge swing and huge difference. Like I said, I was always an overweight kid, was never obese, but always chubby. In my family, they called me the chubby kid in the family. And growing up into high school, you know, I started swimming. Okay, I lost some weight there. But in college, wow, it just, my weight kept going up. And not until we started our weight loss program in our office did I start losing weight and really understanding. Mind you that throughout school, whether it's UC Davis, chiropractic school, I got to the point when I opened this practice, I was about 195 pounds. And really, I went between 190, 195, and that was it. And I was trying. That's me being a health professional, trying to lose weight, understanding the body. So I can only imagine how hard it is and why it is so hard for someone out there with the wrong information to lose weight. See, a lot of times it's not the fact that you have, you're not doing, it's not that you're not trying hard enough. It's the fact that you have the wrong information. And the wrong information, whether it's your health or other parts of areas in your life, that is going to give you the wrong diagnosis, or you're going to end up doing the wrong thing because you have the wrong information. And in our clinic, that's the key thing I want to give people, is I want to give you the right information. Now, what you do with the right information, it's up to you. But at least I know, at the bottom of my heart, I know that you got the right information. Now it's up to you to do something about it. Okay? Thank you for watching. Have a great day.